Hello everyone, welcome back to my YouTube channel. Today I am going to discuss about the triangles of the neck. There are main two types of triangles of the neck, anterior triangle and the posterior triangle. So in this video you will learn about the posterior triangle, and from my next videos you will learn about the anterior triangle. When we talk about the posterior triangle, here this is the posterior triangle and this is the anterior triangle. These two triangles are separated by the sternocleidomastoid muscle, which is a prominent landmark of the neck. So again, posterior triangle divided into two subdivisions, as upper larger part is the occipital triangle and the lower smaller part is the subclavian triangle. It is divided into those two, occipital triangle and the subclavian triangle, by the inferior belly of omohyoid muscle. Posterior triangle is an important region of the neck because it has the communication with the axilla via cervico-axillary canal, which gives passage to neurovascular structures from the posterior triangle to the axilla for onward transmission of the upper limb. Let's see what are the boundaries of the posterior triangle. Anterior boundary is formed by the posterior margin of the sternocleidomastoid muscle. Posterior boundary is formed by the anterior margin of the trapezius muscle. Base is formed by the middle third of the clavicle. Apex is located in the superior nuchal line of the occipital bone between the attachments of trapezius muscle and the sternocleidomastoid muscle. The roof of the posterior triangle is made by the intestine layer of the deep fascia of the neck, which is covered by superficial fascia and the skin. Muscular flow contains from above downwards semispinalis capitis, then splenius capitis, levator scapulae and scalenus medius muscles. I told you earlier as well, the posterior triangle is divided into subdivisions by inferior belly of omohyoid muscle. The upper part is the occipital triangle and lower subclavian triangle. The boundaries of the occipital triangle are inferior belly of omohyoid muscle, then sternocleidomastoid muscle and trapezius muscle. Boundaries of supraclavicular triangle are inferior belly of omohyoid muscle, then sternocleidomastoid muscle and middle third of the clavicle. From this picture you can see the various regions of the neck from very superficially. It is a surface marking like structure, and here you can see D is the anterior cervical region, A is the sternocleidomastoid region where sternocleidomastoid muscle is situated, and C is the lateral cervical region, and B is the posterior cervical region. I showed this picture to gain a rough idea where the triangles are located in our neck. From this picture also you can surface mark where posterior triangle is. Here the descending part of the trapezius muscle here. The descending part of the trapezius muscle here. Then this is the clavicular head, and this is the sternal head of the sternocleidomastoid muscle. It goes like this and inserted here. Then the angle of mandible, then anterior cervical region or the anterior triangle, laryngeal prominence here, then sternal end of the clavicle, jugular notch, and here the area of posterior triangle. Here you can see the posterior triangle. Here the sternocleidomastoid muscle. Let's see what are the superficial contents of the posterior triangle. There are cutaneous branches of cervical plexus enter the posterior triangle by piercing the prevertebral fascia around the midpoint of the posterior border of the sternocleidomastoid muscle. So there are great auricular nerve. This one is the great auricular nerve. Then lesser occipital nerve. Here lesser occipital nerve. Transverse cervical nerve. This one is the transverse cervical nerve. Then supraclavicular nerves. These are the supraclavicular nerves. Those are the superficial contents of the posterior triangle. That means the branches of the cervical plexus. Great auricular nerve, lesser occipital nerve, transverse cervical nerve, then supraclavicular nerves. There is a point called nerve point. That means the junction of upper and middle third of the posterior margin of the sternocleidomastoid muscle, where above mentioned cutaneous nerves and spinal accessory nerve um, bunched together is known as the nerve point. Here is the nerve point. That means the junction between upper and middle third of the sternocleidomastoid muscle, posterior margin of the sternocleidomastoid muscle. So the nerve point means they emerge the spinal accessory nerve and the branches of the cervical plexus are emerged from that point. There is a clinical correlation here in cervical plexus nerve block. The anesthetic solution is injected mainly at the nerve point of the neck. Here, the spinal accessory nerve runs downwards and laterally, lying in intimate relation to the facial root but between the roof and floor. This nerve, spinal accessory nerve, leaves the triangle by entering the anterior margin of the trapezius muscle roughly about 5 centimeters above the clavicle. If you want to surface mark the accessory nerve, you have to draw a line from a point in front of the tragus of the ear to a midway between mastoid process and the angle of the mandible. That means about from here, then the midpoint of the mastoid process and the angle of the mandible, like here. So you can surface mark the course of the accessory nerve. From here, it carry the line to midpoint of the posterior margin of the sternocleidomastoid muscle and further downward to a point on the anterior margin of the trapezius, roughly about 5 centimeters above the clavicle. Let's see what are the deep contents of the posterior triangle of the neck. The supraclavicular part of the brachial plexus, that means trunk stage and few branches, are located in the subclavian triangle, that means lower part of the posterior triangle. The upper trunk of the brachial plexus, here you can see the brachial plexus here. So the upper trunk of the brachial plexus gives off suprascapular nerve and the nerve to subclavius here. And also the branches from the root stage of the brachial plexus are long thoracic nerve and the dorsal scapular nerve. You cannot see the long thoracic nerve here, but you can see a part of dorsal scapular nerve here. This is the dorsal scapular nerve. Dorsal scapular nerve pierces scalenus medius muscle to appear at its lateral margin and leave the occipital triangle behind the anterior margin of the trapezius, as you can see here. Here also you can see only small part of long thoracic nerve. This long thoracic nerve, the C5 and C6 roots of the long thoracic nerve pierce scalenus medius muscle and unite on its surface to form the long thoracic nerve. This nerve enters the axilla through cervico-axillary canal where its lowest root C7 join to it. Then the trunks of the brachial plexus are also very close to the surface in the subclavian triangle, as the skin, platysma and intestine layer of the deep fascia only cover them. Here also you can see the spinal accessory nerve, and here you can see the suprascapular artery. suprascapular artery. Then here you can see a cut section of external jugular vein. Those are also contents of the posterior triangle. Here you have the occipital artery here. Here is a further deeper section of the posterior triangle. You can see very clearly the brachial plexus. You can see the thick nerve plexus here, the brachial plexus, and here the cervicodorsal trunk, and here you have spinal accessory nerve. You can see clearly. Then here nerve to rhomboids, then nerve to levator scapulae, then additionally you have a few cervical lymph nodes belonging to superficial group which lie close to the accessory nerve along the posterior margin of the sternocleidomastoid muscle. Supraclavicular lymph nodes belong to inferior deep cervical group, are situated in the subclavian triangle in close relation to the posterior margin of the sternocleidomastoid muscle. Here a picture with a further dissection than the previous picture. You can see here also the internal jugular vein as well, and here the subclavian artery and the branches coming out from the subclavian artery. Then very clearly the brachial plexus and suprascapular nerve also you can see here, suprascapular nerve. Then here the dorsal scapular artery, and here the anterior ramus of C5 nerve root, and then anterior ramus of C6 nerve root also there. So you can appreciate most deeper structures from this picture. There is a clinical correlation of posterior triangle. That means the supraclavicular lymph nodes are palpated at this site. The left supraclavicular nodes are enlarged in the cancer of the stomach, colon, or testis. These nodes are also called as Virchow's node. If the left supraclavicular nodes are enlarged in a cancer of the stomach, we call it as trapezius sign. The cancer of the lung or breast is spread to the supraclavicular nodes of the side of the lesion as well. And also you have the part of subclavian vein here, and the subclavian vein is a site which is often used for central venous access. Through the central venous catheter, it is safe to give powerful drugs, and it can be also for long-term feeding in a serious patient, or that means thrombosed or collapsed patient. As there is subclavian artery here, the pulsations of the subclavian artery can be felt on deep pressure behind the middle third of the clavicle. The bleeding due to severe lacerations of brachial or axillary artery can be controlled by compressing the third part of the subclavian artery downward and backward against the upper surface of the first rib. So that's all about the posterior triangle of neck. Hope you gain knowledge about the posterior triangle and the subdivisions, boundaries of the posterior triangle, then the contents of the posterior triangle, that means the superficial contents as well as the deeper contents, as well as what are the clinical correlations of the posterior triangle, and the importance of knowing the structures uh, which is located in the posterior triangle. So if you like this video, please subscribe my channel for more videos and put a like and comment in the comment section. Thank you for watching.